Many of us cringe at the idea of a chemical peel. It truly doesn't deserve all the bad rep it gets. It's affordable, it improves your collagen production, and these days you can have options that don't require a ton of downtime of recovery. When done correctly, this treatment is super beneficial and even helpful for people with sensitive skin types. Hi, I'm Jurnain Mertens from Beauty by Code, and I am here to help you navigate the best trends and clean beauty options to maintain a healthy, beautiful, gorgeous, and vibrant skin. So welcome to my channel. So today I'm going to talk to you about what chemical peel is best for your unique skin type, how to care for your skin after the procedure, and the best ways to prolong the effects of your peel. First, what is a chemical peel? It's a procedure where a chemical solution is applied to your skin to remove the top layers so the skin can grow back smoother. It's usually used to treat wrinkles, discoloration, scars, and it can be done at different depths. Okay, so you will have like a light peel, a medium peel, and a deep peel. When you go to the, for the light medium version, you usually need to go to the procedure several times to get the best result. On the other hand, with the deep peel procedure, it will give you like more dramatic result, but that, however, takes longer to recover from, and you won't be able to do stuff like go to the park and expose yourself to heat. Now, is it risky? Well, I mean, of course, and everything has risk, and those horror stories aren't all false. But instead of looking at them as reasons not to do a chemical peel, well, look at them as reasons to do your research and learn which procedure suits your skin type. Now, you don't want to get a chemical peel if you have taken any acne medication, I will say, in the past 3 to 6 months. You also can't do it if you have a history of areas with an overgrowth of scar tissue, or if you have regular cold sores outbreaks, or of course if you are pregnant. If none of these apply to you, you still want to check with your doctor before putting anything on your face. So there is something called the Fispatric skin type system, and it divides people into 6 groups based on their skin, hair, and eye color. This model even helps detect skin cancer risk and understand what kind of skin treatments suit which types best. It's like a matchmaker system. So let's dive in. The Fispatric Type 1 includes those with pale white skin, blue or green eyes, and blonde or red hair, with skin that cannot tan and will always burn. Hello to my fellow beautiful gingers out there. Type number 2 is fair skin with blue eyes, but these people can tan, but they are also still prone to burns, so don't get too comfortable out there. Now, type number 3 includes darker white skin that will initially burn but later tan. Type number 4 is light brown skin that tans easily with no burn. Type number 5 is brown skin that tans very easily. And the last one is number 6, which is, dark brown black skin that will tan easily and very dark. So your skin tone and type will determine how a chemical peel will work for you. Pay attention, this doesn't mean that if you sit on a certain end of the spectrum that you cannot get this treatment. But it's known that darker skin types are prone to hyperpigmentation after certain peels. The best candidates for a chemical peel are usually types 1, 2, and 3 because they show fewer complications after the peel. That doesn't mean that you will face 0 problems after the peel. Now, for those of you with skin types that are 4, 5, and 6 on the scale, I think that you should go for lower strength peeling agents like salicylic acid, glycolic, and enzyme peels that are level 1 or marked for a daily use. Okay, so they are not as harsh on your skin. It's a good option. Now, how often you get a chemical peels depends on the strength of the treatment. For superficial, right, like surface level peels, you can get them once a month, I will say, without problem. You always need to, see how your skin reacts, but once a month, it should be okay. Deeper peels though, you will need more healing time. So you can get them more than, I will say, once every 2 to 3 years. Now, how to prep for a chemical peel? Listen, regardless of which peel you are getting, you have to prep your skin before the treatment. Before your peel, and depending on what you're doing, your doctor might give you an antiviral before and after the treatment to prevent any viral infection. You may also need to use some type of retinoid cream weeks before your treatment, and I'm saying weeks before, not 7 days before. Actually, around 7 days before, you will have to stop all things that are a bit harsh on your skin. Like seriously, stop everything. And that brings me to my next point, right? Like go easy on other treatments and makeup or, cosmetics. About a week before the peel, don't do any hair removal treatments like electrolysis, and avoid face masks and face scrubs. Basically anything that could be even slightly abrasive, which means no shaving either. I know, the peach fuzz is annoying, but don't do it. You can, however, do a nightly retinol regimen to clear your skin and smooth your wrinkles. This will help you to see, deeper and more evenly distributed results after your peel. Again, I am not talking about 7 days before the peeling. I'm talking about several weeks before, and just one thing. Listen to this, right? Like make sure that you clear your retinol regimen or system or routine with your doctor. All of this isn't just to make your procedure go smoothly. It also prolongs the results of your chemical peel. So you really get your money's worth. And finally, you will need someone to pick you up because there is a chance that you may be sedated during the procedure. Again, it depends on the depth of the chemical peel. After the chemical peel, the procedure will last depending 30 to 60 minutes. And, once you're done, regardless of the depth, your skin will be red, kind of, like tight, and you will feel irritated and a bit swollen. But don't you worry, this is totally normal. Don't pick on your skin, don't rub it or scratch it, leave it alone. With a light chemical treatment, your doctor will apply like a protective ointment on your skin, something like petroleum jelly, just to soothe your skin. You can usually, and I say usually, wear makeup right the next day, but I wouldn't advise it. Now, if you got a medium chemical peel, you may feel some stinging, and your doctor will put an ointment to prevent dryness, and you can use cosmetics after, I will say, 5 to 6 days. You can use ice packs, right, to help with the healing process, and if it's too much pain, you can use over-the-counter painkillers. But seriously, don't worry too much though, because as the swelling comes down, your skin will form like a light crust that will darken, and over time it will develop some brown splotches, and it's totally normal. It will take, I will say, like a full 14 days for your skin to heal, but the redness will stay for a couple of months. The good news though is that you can use makeup to cover up that redness. So don't worry. Now, with a deep chemical peel, you will have severe redness and swelling, and you may feel some burning. But if you have done your, your prep before the peel, if you've done everything right, you will be totally fine. The doctor will apply surgical dressing and it will prescribe some painkillers, and you will have to put some healing, creams or ointments several times a day for around 2 weeks. Your face or the treated area will develop a new brown skin in about 2 weeks, but the redness will stay for a while. In the case of a deep chemical peel, you will have to stay at home to recover. And you have to avoid the sun as much as possible and schedule a few follow-ups with your doctor to monitor how well your skin is healing. Now, if you want to get the best out of your procedure and prolong the positive effects, which why wouldn't you? Here are some ways to do it. First, SPF 50 sunscreen. You need, higher protection, and go for a formula that won't be greasy or that will irritate your now sensitive, very sensitive skin. Okay? Take a small amount and apply it to your face, and don't forget your neck. You will also need sun protecting, clothing and hats. It's recommended that usually, you wear a hat that is like a wide brimmed hat. Imagine that you are creating like a personal bubble of protection just for yourself. You can also use some antioxidants like vitamin C to prevent sun damage when you have been cleared by your doctor, right? My best advice though is to schedule the peel for when you know that you will be mostly indoors. I know a lot of you are busy, hustling, but if you have to travel or if you have to be outside in the sun, well, maybe doing a chemical peel is not the right move, right? Unless you're going for something very light. So keep it for the winter days or the holidays if you want to scare the people, that come for Christmas. No, seriously, just keep it for when you can be at home and you can recover at your own pace. Thank you for being here with me. Leave a comment below, like, subscribe, this is important. And tell me something about yourself. I am growing a community and I want to know who you are. Thank you for being here. I appreciate you. Talk to you soon. Bye for now.